Today, we will be talking about the integument, disorders and diseases. My name is Mary Shea Woodard, and I will be talking about the causes and symptoms of eczema.
My name is Maddie Duncan, and I will be talking about the diagnosis and treatments of eczema.
My name is Marcia Ramirez, and I'm going to be talking about the causes, the risk, and the symptoms of basal cell carcinoma.
My name is Michaela Schupak, and I will be talking about the diagnosis and treatment of basal cell carcinoma.
The integumentary system is an organ system made up of the skin, hair, nails, and exocrine glands. Its function is to protect the body against injury via the skin, which is the largest organ and the first line of defense from the environment. Another function is to maintain moisture of the skin, thermoregulate, which is done by excretions from the exocrine glands, and to detect temperature, pain, and pressure signals. The integumentary has three parts. The epidermis, which as you can see in the image, is composed of stratified squamous cells and other specialized cells that work in many different ways to protect the body from pathogens, burns, and chemicals. The second layer, which is the deep layer of skin made up of dense irregular connective tissue, is the dermis. The dermis is composed of nervous tissue, blood, and blood vessels, and it gives the skin its strength and elasticity. The hypodermis is the third layer of the integument. This layer of connective tissue provides flexible connections between the skin and underlying muscle, bones, and fat.
The first disease we will be talking about today is eczema. The cause of eczema is currently unknown, but the majority of researchers link it to a combination of environmental triggers and genetic factors, such as allergens. Eczema is an intradural epedema, which is a pocket of fluid underneath the skin, which can be seen in the photos. The most common symptom of eczema is a rash. These rashes have often been described as red and itchy and scaly. Most rashes occur as an infant, but is not limited to childhood. They can be triggered by things such as stress and can continue into adulthood. As you can see in the photos to the right, the rashes look red and flaky and even sort of scabby. Rashes most typically occur in the crook of the elbows or the bends of the knees.
For the diagnosis of eczema, red, dry skin is a primary indicator. Notice in the image the decreased presence of immune cell nuclei in the dermis with eczema and the lack of keratinocytes in the epidermis. This absence causes itchiness and dryness to occur. To rule out other skin conditions, doctors may run tests like a skin patch test. Additionally, one's medical history is also a factor when diagnosing because asthma and food allergies are known to accompany eczema. Atopic eczema is the most commonly seen form and can appear periodically and is stress-induced. Treatments for eczema include creams, anti-inflammatory drugs, antibiotics, and light therapy. Creams are used to control itchiness and repair the dried out skin. Anti-inflammatory drugs should be used on a short-term basis to help with inflammation of the epidermis. Antibiotics help in cases where the skin becomes infected. Exposing the skin to light or light therapy is sometimes helpful for adults, but should be done in small amounts because UV can damage the cells of the epidermis. Infant eczema requires more careful treatments, typically ointments, as the skin is more sensitive to the environment.
Okay, so now we're going to be talking about basal cell carcinoma. Basal cell carcinoma is a non-malignant skin cancer that is rarely fatal, but if left untreated can metastasize and become fatal. The sun itself cannot cause basal cell carcinoma, but the ultraviolet radiation that comes from the sun can. The basal cells are in charge of the process of creating new cells, and long exposure to the sun's UV radiation can cause basal cell DNA to mutate and abnormally reproduce, which can cause a tumor, in this case, the basal cell carcinoma. A sunburn is a short-term indication of potential long-term DNA damage within our skin basal cells. It is a way of our body showing that our skin cells are being damaged by UV radiation a bit too much. So at the top right picture is we're showing a sunburn, and at the bottom right, it's how our skin reacts to UV exposure over a period of time. So the risk of basal cell carcinoma increases the older the person is and will affect the male sex more than the female sex. This is mostly because of the cumulative effects of sun exposure and the lack of protection. That's why sunscreen and other precautions like long sleeve and hats are vital. Family and medical history also affect an individual's risk of basal cell carcinoma. If it runs in the family, your chances increase, and if you have a sort of pigmentation disorder like albinism, which is the lack of melanin production, you're also more prone to basal cell carcinoma. Okay, so going on to the next slide. Okay, so here we have the stratum basal layer of the epidermis, which rapidly divides. That's number 5. And it does so to replenish the epidermal cells from the layers above. Because of this, it must be protected from the sun's radiation and UV light. The cells that provide the protection are called melanocytes. Melanocytes produce melanin and what we more commonly know as our skin's pigmentation. So if somebody lacks melanocytes, they have less melanin and therefore a lighter skin tone or a lighter pigmentation. They have less protection against UV radiation than those with a darker pigmentation, which is why individuals that are lighter in skin color are more at risk of basal cell carcinoma. Other factors that can affect this are exposure to tanning beds, exposure to arsenic, or other harmful chemicals. Going on to the next slide. Okay, we have the symptoms. Most of these symptoms will occur physically. There'll be something that you can visually see. It's different from the rest of the skin. These symptoms will often appear as a form of scaly red patches throughout the body, small bumps or nodules, and even sores or lesions that occasionally bleed and don't seem to ever heal. They'll also tend to appear in areas that are more exposed to the sun but aren't limited to them. So usually they're going to appear in areas like the face and the arms when they have overexposure to the sun or its UV radiation, but they can happen anywhere else. Some of these can often be confused with scabs, moles, or pimples. They often go disregarded because of the lack of awareness. We actually have several variants of basal cell carcinoma. At the top right, we have images of the skin, and at the bottom part, we have the histological images of those. So we have superficial basal cell carcinoma as a multifocal nest of atypical basiloid epithelium arising as buds from the basal layer of the epidermis. We have nodular basal cell carcinoma, and this is in a form of a solid tumor nodule. We also have pigmented basal cell carcinoma, and these are focal deposits of melanin throughout the tumor. The image actually shows an increased number of melanocytes within the tumor, and melanocytes, and macrophages, which are basically, melanophages, which are macrophages that eat up melanin granules. So that's the darker area of that third image. Okay, so the next slide.
And now we're going to be moving on to the diagnosis of basal cell carcinoma. So first off, we have skin examination. As shown towards the bottom left, a doctor or nurse will check the skin for bumps or spots that look abnormal. When they do this, they'll look at like the color, the size, the shape, and the texture. So then at the top right, you can see where it's pointed out the basal cell carcinoma. You can see like the abnormality. So another way that you can diagnose basal cell carcinoma is through a biopsy. So when concerning any type of biopsy, the abnormal looking growth is removed from the skin and viewed under a microscope by a pathologist to see if cancer cells are present. So there's 3 different types that I have listed. So first off is a shave biopsy. This is when a sterile razor will be taken to shave off the abnormal looking growth. And then there's a punch biopsy. And during this biopsy, a special instrument called a punch or trifon will be used to remove a circle of tissue from the abnormal looking growth. And then finally is an excisional biopsy. So during this biopsy, a scalpel, a punch biopsy, or a shave biopsy tool is used to remove the entire growth. And then this is shown by the image on the bottom right. So next off, we will move to treatments of basal cell carcinoma. So there are many different ways to go about an attempt to cure basal cell carcinoma, probably the most common way is chemotherapy. So chemotherapy uses anti-cancer drugs to shrink or kill cancer cells, and then this will reduce cancer spreading to other parts of the body. Then we will have photodynamic therapy, which is a two-stage treatment that combines light energy with a drug designed to destroy cancer and precancer cells after light activation. So they're usually activated by a specific wavelength of light from a laser. So then, as shown in the image at the top right, radiation therapy uses high energy radiation to kill or shrink cancer cells. The way radiation therapy is given depends on the type and the stage of cancer being treated. In most cases, radiation is used after surgery to destroy any cancerous cells that could potentially remain in the surrounding area. So then we'll have Mohs micrographic surgery, which is an advanced surgery technique that precisely removes all forms of cancer while preserving healthy surrounding tissue. This is the type of treatment which will be shown in the bottom right. And finally, we'll have electrodesiccation and curettage. And this is a procedure where the tumor is scraped off of the skin and an electrode is used to treat the area with an electric current, which will stop the bleeding and destroy any cancer cells that remain. So now we're going to move on to the exam questions. So in the image below, you'll be able to see a labeled picture of the layers of the skin. So since one of our diseases was basal cell carcinoma, and you need to be able to distinguish which part of the skin contains basal cells. So A does not show basal cells. It shows squamous cells, which can be distinguished by their thin and flat shape. B shows a melanocyte. They have a dendritic shape, and to me, they look like little octopuses in the skin. And so C is what we're looking for. At the bottom of the epidermis, that's where you will find the basal cells. So therefore, the answer is C.
Our next exam question pertains to eczema. The question is, which of the following can be related to eczema? The answer choices are A, asthma, B, food allergies, C, harsh soaps or detergents, and D, A and B, or E, A, B, and C. The correct answer is E, A, B, and C. Both asthma and food allergies are often linked to eczema and is used when looking at medical history to determine if someone is at risk for eczema. Harsh soaps and detergents are also related to eczema because they can trigger flare-ups of rashes. So the correct answer is E, A, B, and C.
Okay, so now we have exam question number 3, and it is, which of these images are correctly matched with its histological image? Okay, so the answer is going to be A. So A is pointing at the correct histological image. It's pigmented basal cell carcinoma, and you can tell by the more pigmented area at the bottom right image. So C, the nodular basal cell carcinoma is actually pointing to superficial basal cell carcinoma, and the superficial basal cell carcinoma is pointing to the nodular basal cell carcinoma. So they're actually flipped.